Are you tired of the burning, the tingling, numbness, or shooting pain in your hands, legs, or feet? Are you losing sleep at night, finding it hard to get your balance when you stand or walk? Maybe you feel like there's a sock balled up under your foot, and it's really likely that you're experiencing symptoms of peripheral neuropathy. Hi, I'm Dr. Alan Nathans, and I've been serving our community for 25 years, and in that time, I have taken care of tens of thousands of people, and thousands of them have been folks with these exact symptoms. We've got more than 300 5-star Google reviews and patient testimonials that prove that our protocols and methods work.
Would highly recommend somebody to take that step if you want to feel better. It's just been amazing for me. Amazing.
I am 2 months into my treatment for decompression. Well, today was an amazing day. I worked in my yard yesterday really hard for about 5 hours. And when I woke up this morning, I had no back pain. And normally I have to stretch and have back pain, take Tylenol and all of that. But this morning, I didn't have it. It was wonderful. And today was also a day of soft waves. So I'm having more feeling in my feet. My neuropathy is decreasing. I can now feel when I touch the bottom of my foot, I can feel my finger on the bottom of my foot. Before I could not do that. It is amazing. I highly recommend these folks here. It's like coming to a family meeting when I come for treatment. It's really nice. And I've been coming here for 20 years, so there you go.
In this video, I'm going to cover how we make the diagnosis, determine the severity, customize a plan to reverse the diagnosis without using brain and nerve-numbing drugs, needles, or surgery, even if you've tried everything and nothing's worked and you're close to giving up. So what's the main problem here? Now, I could nerd out about the science of this for hours, but in a nutshell, peripheral neuropathy is nothing more than the network of blood vessels and nerves in your hands and or your feet that are dying. And here's a scary fact. Peripheral neuropathy is the #1 neurological disease in America, affecting approximately 20 million people. Once the nerves exit out of your spine, they go to your arms, legs, and feet, and they're called peripheral nerves. The communication from your brain to your extremities, like your arms and your hands and your legs and your feet, tell your muscles to feel and to move. And when these nerves are irritated or they begin to degenerate, they become damaged, and a whole list of symptoms begin to occur, like burning and tingling, shooting pain and numbness. You get a lack of balance, unsteadiness on your feet, aching in your feet. You can't sleep, and there's pain while you're sleeping. And if you've experienced hot and cold changes, that's common as well. So when these symptoms happen, people will go to their primary care doctor, their neurologist, or find a podiatrist to figure this thing out. And the primary care doctor, they'll prescribe a drug for pain and eventually send you to a neurologist. What's the neurologist going to do? Well, they're well-meaning, but they're going to prescribe a higher dosage of the drug and or prescribe a different, more toxic drug, and then do a nerve conduction study. The podiatrist will do a cortisone injection or try to get rid of some of the inflammation and prescribe some special shoes and or orthotics for the shoes that you're already wearing or new shoes. The drugs that these doctors are prescribing are drugs that are meant for someone with seizures. Drugs like gabapentin and Lyrica and Cymbalta. This class of drugs will shut off the signals from your brain to your limbs and from your limbs to your brain so that you can't even feel them. Meanwhile, the blood vessels and nerves, they continue to decay, and as time goes by, the nerves eventually die. Peripheral neuropathy can be caused by over 100 different reasons, and the top 5 that we see are long-term alcoholism, diabetes by far is the greatest, and autoimmune diseases, vitamin deficiencies, and also what is growing is side effects from cancer treatment. So peripheral neuropathy can also be a structural problem in your spine, and it's easy for us to determine that when you're in our office. So when all is said and done, the root cause of neuropathy is either caused by a spinal problem, we got you covered, or it's caused by a blood flow nerve dying problem, and we've got you covered there too. So as neuropathy progresses, People lose their ability to live a normal life and enjoy life, and simple tasks become insurmountable. Being able to walk around or spend time with friends or family or just get some sleep is impossible. Staying home, you become isolated and you miss out on the norm of life. If you're here now and you don't know about me and my No Needle Concierge Regenerative Clinic, I'm sorry that you're just finding out about me, but I'm here to help. There is a way out. So step one is to assess the severity of the neuropathy. Nearly all of our patients tell us that the exam that we do was not done by their neurologist or their PCP or their podiatrist, and that it's very comprehensive. From thermal imaging, we can clearly see the blood flow damage that's present. The feet should be all red with maybe a little bit of yellow. They should also be the same left to right, and anywhere there's green, blue, purple, or black, it means that the blood flow is missing and nerve death is coming, or either it's happening. You don't want this. Peripheral neuropathy is like a runaway train. Once it starts, it's really difficult to stop and reverse unless you catch it in time. And from the sensory exam, that's what we'll be able to determine the exact severity and where you are on this chart. So you want to be over here where it's low severity and not high severity. Past a certain amount, it does become irreversible, so catching it quick is really, really important. These tests, along with the x-rays that we'll take of your spine in a physical exam, they tell us if you're a good candidate and if you qualify for our protocols. Our process includes 3 phases of care. The first phase is the crisis phase, and this is where it's all about getting relief and getting stability. The critical transition, it's all about rehabilitation and regeneration, honoring your body's innate potential to heal. And the lifestyle phase of care is all about optimal performance. So how do we make these 3 phases of care work? Well, number 1, we remove the nerve interference in your spine, improving communication from the brain to the body. We'll then take a detailed image of your spine and identify and begin to correct old spinal misalignments, reconnecting the nerve flow. Then we're going to regenerate and grow brand new blood vessels with innovative no-needle technology like acoustic sound waves and infrared light. And we're going to stimulate and regrow atrophied nerves using electrotherapeutic stimulation. And we're also going to provide you with the right advanced nutritional support to help you grow more blood vessels and nerves. And you'll also have one-on-one access to us in the office on a weekly basis. All of the treatments that we employ are FDA cleared and they work.
Where she had a 73% sensory loss, she now has a 37% sensory loss. Where she had a 75% sensory loss, she now has 43% sensory loss. This is because Marion took the program seriously. She decided that she was going to invest in her own health. She didn't want to be in a wheelchair. She didn't want to have walkers. She didn't want to have canes. She didn't want to lose her feet. She didn't want to be on medicine. And she took matters into her own hands, did the work, and the outcomes are incredible. So I'm really super proud of Marion. And we will check back in another 3 months or so and see what the changes are then and just see how her progression is.
By following our process, people get results. They get back what neuropathy took from their life. We get about a 95% success with our Blueprint or Neuropathy program. And our program is implemented by close to 1,000 clinics across the country. And together, so far, we've successfully helped tens of thousands of people reverse peripheral neuropathy. In the old way of dealing with neuropathy, you're stuck dealing with frustrating doctor's visits, the gerbil wheel of drugs, needles and surgery, and going down the doom loop of degeneration, leading to isolation and despair, and worst of all, amputation, because you couldn't even feel the cut that happened to your foot and then it got infected. And this kind of thing is common in a worst case scenario, but it does happen. With our protocols, you regrow your nerves, become stronger, avoid losing limbs. You get back the freedom and independence to live your life on your terms, the 100-year lifestyle way. Now, if this makes sense to you and you're ready to finally reverse your neuropathy, here's what I want you to do. Click that button on this page, to see if you qualify for our program. And when you do that, you'll talk to my team who will share with you how this all works for your specific situation. Now, to be clear, this is not for everyone. This isn't for someone who isn't serious about reversing the neuropathy. So who's it good for? Who is this program right for? Person number one, they are just ready. They're aware that they have a problem and they're ready to do something about it. They're 100% committed and they're willing to do what it takes to fix it. Person number two is just like person number one, but sometimes they can get a little off track. That's me. And people like me, we need a little nudge sometimes, but they just need a little bit of guidance and they get great results. And person number three, they're skeptical about everything. They're stuck in the old way. They're not ready to commit. They want insurance to pay for everything and they're not willing to invest in their health. I want to tell you that our methods have worked for thousands of people. And if you want to live your best 100-year lifestyle and fix your neuropathy naturally, you could be next. And once again, I'm looking forward to helping you. My name is Dr. Alan Nathans, and I hope that you have a fantastic day.